I do like these Monday updates. Hello, Raleigh. Robert Courts coming to you live from your backyard. We are delighted to have our regular feature, Dr. Susan Lavelle of Premier Wellness, providing us with the COVID-19 update. Thank you for joining us, Dr. Lavelle.
Always a pleasure, Robert.
And I'm going to go right to update us, please. What's going
Okay.
on out there?
So the first thing I'm going to talk about is really quick, and it's one of the things that we're doing that we can do for ourselves, and that's about protein. So we're talking about how important nutrients are for us at this particular time, and protein and amino acids are what helps us build our immune system. And so, how much protein should we be eating? Well, but here are some numbers for the average person, not the super athlete, not the total couch potato, but somebody
Right.
who's right there in the middle. You want to eat about 1.5 grams of protein per kilogram of weight. Okay.
Ah,
So if you are in, most people know how much they are in pounds. And so I figured that out. It took me a little bit with my calculator. And so that would be 0.68. Okay.
okay.
You want to look at pounds, eat 0.68 grams of protein per
Ah,
day, per pound of weight. Now, with those numbers, so say you're very much overweight, we're just going to kind of go that way. You don't want to use those numbers. You want to use your optimal numbers. So if you're very, very overweight, don't use that. Use what you
right.
should be, and then that would be the amount of protein that you're eating. So that's just a little tidbit as to know where to start. And then, as I said, if you're very, very active, doing a lot of weight training, you want to up that a little bit, and vice versa if you're sedentary. Okay.
Well, I've taken to heart what you told us weeks and weeks ago when this started, is that your immune system personally is the best defense you have. So keeping yourself healthy and emotionally in line is the best defense against the virus. So I'm a little concerned about all of this talk about opening up, and some of our states around us are opening up.
Mhm.
What's your professional opinion on that, Dr. Lavelle?
So I totally understand people are getting a little antsy. They want to get out, want to get back to their lives, essentially. But, let's take a look at Georgia, for instance. And that's one of the biggest states who's, kind of going back in. And at least in my opinion, and the opinion of many other scientists and physicians, it's not a good idea right now. And the reason for that, there is multiple. One of them is that Georgia's curve has not lowered yet. That's what one of the things that we were
Mhm.
looking for, is that if the number of cases and everything is actually on the downswing. And in Georgia, it's not. It has been rising steadily. And over the last few days, if you look at it, you may interpret it, maybe it's level, but it is definitely not on the downside. So that's one reason. Another reason is that, if we look at the populations that are at risk, those are the ones who are obese, who have heart disease, who have diabetes, who have
Right.
lung disease. And Georgia has a very high concentration of clients and patients with those particular diseases. They're
Right.
very high compared to the rest of the United States. And then the third thing that is something that we need to all keep in mind is that, if you look at stats, that Georgia has a very high uninsured population, of health insurance. And so you put those things together, and it's just a worrisome thing to me. So, were I living in Georgia at this time, I would be stepping back still, and continuing to do what I'm doing as far as distancing, keeping sanitation, keeping my immunity up as well as possible, and then watching. Let's
Right.
watch for the next couple of weeks and see exactly what happens.
So, keeping in mind that even if your state or municipality opens up, you can stay at home.
Oh, absolutely.
You can continue to protect yourself. If I'm going to be extra cautious and stay longer than recommended by my government, will you please reiterate the two or three trends I should be looking for to feel safe?
So the first thing is that you look at your state's numbers. If it's rising, if it's still rising, corona cases are still rising. Absolutely not. if it's level, but what we really want to see are the numbers on the decline, and not just for a day. We want to see them
Right.
declining for several days in a row, at least a week, really,
Right.
and then going on from there. And if that's really the number one thing. The number two thing is, how much testing is actually getting done. Of testing of people who may or may not have coronavirus. So that would be another big issue. Is the testing keeping up with the number of cases? So that would be the other.
So we can keep an eye on it ourselves and make our own determination.
Absolutely. Absolutely. And I think that's probably the best thing to do.
I know that I plan on being a little extra cautious. How, I won't say dangerous, but if South Carolina were trending like Georgia,
Mm-hmm.
is there any safety in being in the middle of the state versus the side? Or it seems to me, I guess, Dr. Lavelle, where I'm going with this, it's still a lot of people out there. And so Georgia's, in a way, risking our health.
Mm-hmm. Well, the thing of it is, if you look at the maps of where the concentrations are, it usually has a lot to do with population concentration. So in Georgia, it's Fulton County, it's
Right. Okay.
it's all of the ones, DeKalb, it's all of the ones that have a lot of population densely right there. With the one exception, there's one in the south of Georgia, and that one has a large elderly population in nursing. So it's kind of, it's you have to look at the numbers that are there.
Yeah.
So your safety really, is in numbers or lack of numbers, and then just staying away from that.
So it's not just my state necessarily. We should keep an eye on the national trends.
Yes, absolutely.
And I believe New York's kind of our bellwether.
Oh, yeah. Unfortunately, yes. Yeah. And as I had mentioned before, I know a lot of people there. That's where I trained, and so
right.
The numbers, and if you think about it, New York is, if you think of people being sardined together,
right.
that is it.
From all over too.
Yes, right? Yes. Yeah. The entire city is like that. And plus they have a lot of outside travel. So you put those two things together and, it's no wonder it is where it is right now.
Do you happen to know where their figures are trending? Are they still seeing an increase in cases, or do you even follow New York?
Yeah, I do. Yes. I have family still there. So still increasing, but it's starting to level off. Okay. And there were a couple of days where, it actually looked like it was declining. So it's more still in that little bouncy up and down kind of thing.
So we'll keep an eye on it. Everyone needs to make the decision that's best for them. And you don't necessarily have to do what to go out, even when the rest of society is.
Exactly. Especially if you have those comorbidities, take a little extra thought.
Can you speak toward once this is over in a week or 3 and we're out there, we're hearing a lot about the second spike. Can you illuminate a little bit of information on that?
Mm-hmm. Essentially what that is because there's such a long latency period, it's 2 to 14 days, which is a pretty long period of time.
Right.
You may not be showing symptoms, but still have it. And
right.
if you're not tested and you're going out, that's what we're expecting. Either the people who actually had it before, everything was opened up, or people, as you mentioned, coming from other states, from other areas who, may have it and then bring it into the area. So those are 2 reasons why things may spike after things are reopened.
So keep your mask, your gloves, and
I would say keep your mask and gloves on for at least a couple of weeks, even after things are open and you feel completely safe.
Okay, let's take a little bit longer approach. This is often compared with, not exactly, but similar to the influenza of 1918. Mm-hmm. And that particular was a dangerous virus pathogen for us. But we're no longer worried about it because it no longer exists really in the community. Mm-hmm. Well, the same thing happened to COVID-19, where there's a time where we're not too worried about it.
That's what we're hoping. It all depends on how it mutates, and it has mutated several times, even from the very beginning. So it's actually doing this very rapidly. Now, this is nothing new for a virus.
Right.
Influenza does that. every year. That's why our vaccines are usually a year behind, because they mutate, we change, we have
Right.
to develop another vaccine. So yes, we are hoping that this will eventually either burn itself out, or
Right.
it will have the
Milder
treatment.
version, or some
Exactly.
that doesn't do the congestion and some of the more dangerous.
Exactly.
So there's we need to remain cautious, keeping our precautions in place and doing the right thing. But there is a metric for when this will end, and that's very hopeful to me.
Yes.
Thank you for providing that. Before I let you go, Dr. Lavelle, is there anything you would like to add, or any more you'd like to?
Well, I think I'm actually pretty good for today. Yeah.
Well, I'd like to put in the plug. If you're out there and you're worried, Dr. Lavelle is available to you. She has several ongoing webinars. She's a fantastic resource. And if you want to reach her, what's the best way to contact you, Dr. Lavelle?
Either by phone, which is 919-925-5910, and our website is below, www.premierwellness.com.
Well, we certainly do appreciate your Monday updates. You're a heck of a resource, and Raleigh is very lucky to have you in its backyard. Thank you, Dr. Lavelle.
Thank you so much.
And this is Robert Courts reminding you that Dr. Lavelle and all of your local health experts are right here in your backyard. Take the time to discover the power of local health. You'll find that you feel better, you have a better team in your corner, and that you will get healthier more quickly. Sorry. Thank you, guys. See you soon.
Thank you.